welcome to the Inspirante podcast. My name is Arnav and I'm one of the co-founders and co-presidents of Inspirante Education. I'm a 17-year-old rising senior at Lynbrook High School who's passionate about studying computer science. In school, I'm captain of the Lynbrook Policy Debate Team and president of the First Tech Challenge Robotics Team. I'm eager to give back to my community as I'm deeply involved in leading nonprofit operations oriented around community service. Hello everyone and welcome back to the Inspirante podcast. From not being able to see others to having to stay at home and limit physical activity, the pandemic has brought about a year of mental and physical challenges, and it can be extremely tough for students to cope with such emotions coupled with the stress and of their academic and extracurricular activities. As life gets back to normal, it can also be mentally taxing to get accustomed to what used to be normal before the pandemic. Today I'll be talking to Dr. Navneet Singh, a pediatrician at the Palo Alto Medical Foundation, who has years of experience working with children of all ages and will be discussing helpful tips and strategies to get around these obstacles. Welcome, Dr. Singh. We're glad to have you on the show.
Thank you so much, Arnav, and I'm happy to be here.
How have you been coping with the pandemic so far as a doctor and as an individual?
Thank you for checking in on that. So, as a doctor, I think the pandemic has been rough for everybody. I'm a frontline healthcare worker, so I think it's been kind of especially stressful for me, especially at the beginning when there were so many unknowns regarding COVID in terms of, how do we do testing and, treatments and all those kinds of things. So I think there was a very, very steep learning curve for me personally, as we got to kind of understand more and more about the virus. But now that it's been over a year, I think we do have a much better sense of the virus and, how to treat people who get sick from the virus, which has been really good. Of course, the numbers are getting much better now with vaccination rates much better. So I think we're definitely in a positive phase.
Were you not really seeing many patients in the beginning? Or were you seeing a lot of patients who perhaps maybe had COVID and your workload might have increased then?
Initially, my workload actually decreased significantly. So, I think that when the COVID pandemic started, people assumed that all doctors were extra busy. In fact, I was actually less busy. And the reason for that is because the clinic that I work at was designated as a quote unquote clean clinic. That's because, as you mentioned, Arnav, as a pediatrician, I see children of all ages, including fragile babies. We wanted to make sure that we had an opportunity for families to still have their babies come in for their routine well baby visits and not be worried about them getting exposed to COVID. So my clinic made a policy, which I think was very good, to keep, as I said, our clinic a clean clinic. So we would not see anybody that had any fever, sore throat, cough, body aches. They were all screened before they even set foot in the door. So as a result of that, I was not seeing nearly as many patients as I would have before. As a pediatrician, we often see kids who have colds and ear infections and asthma and pneumonia. So none of those kids were coming into my clinic here specifically. I was mainly seeing, kids coming in just for routine checkups. We did have a separate clinic called our respiratory clinic, where that's where we were kind of triaging patients who did have fever and COVID-like symptoms. So I did rotate through that clinic, as did my other pediatricians, but that was, pretty occasional.
So perhaps maybe later, you guys got more patients who came in for routine checkups, correct? As your clinic maybe transitioned to a clean clinic, right?
That's true. I think it all was based on, like a lot of other things, it was all based on what the numbers were like. So, initially in summer of last year, as things started to get better, the numbers were getting lower. I think that my patient volume did start to commensurately increase. But then, at the end of last year and certainly at the beginning of this year, when the numbers were not that good, I think that my patient volume kind of decreased again. Now it's back on an upswing, as more people are getting vaccinated and as the numbers are getting lower. So I think it really kind of reflects what's happening in the general population.
From that, we'll jump straight into talking about mental health topics. From your experience with seeing patients, how has the pandemic perhaps affected the mental health of students or just individuals in all demographics?
I think this is a really good point, and I think it's a really good discussion that we're having. One of the things that I always try to do as a pediatrician is make sure that I'm addressing not only my patients' physical health, but their mental and social and emotional health. And after having been in practice for more than 20 years, I've realized that these two are often tied together. So, when you're experiencing certain mental symptoms, emotional symptoms, it really can manifest with real physical symptoms as well. So, for example, having recurrent headaches, recurrent stomach aches, feeling really tired, those can sometimes be due to mental or emotional issues. And so sometimes the best way for me to make my patients feel better is not necessarily to give them a medicine to treat those things, but to treat the underlying problem. So I think it is really important to address that. Specifically in terms of pediatrics, I would say, especially for my teenagers, there has definitely been an impact mentally in terms of the COVID pandemic. And the reason for that is because everything in pediatrics is very stage based. I think it's always important to think about developmental stages for children and for young adults, such as yourself. So in terms of stages developmentally during the teenage years, it's important to know that, teenagers are very keen on peer relationships. So, of course, we all need and like social interaction, but during the teenage years, it's especially important. It just matters a lot more to teenagers. So I think what's been really tough during the pandemic is, when everything was for online learning, teenagers were not having opportunities to interact with their friends, which can be tough for all of us, but I think it's especially tough for kids. So I think just the feeling of being isolated, is tough. A lot of my high school students were not able to participate in organized sports the way that they normally would. So, being able to see friends on the soccer team or the baseball team, basketball team, that wasn't there. Not having those opportunities to exercise, which we know is really important for mental health, that wasn't there. So I think it's a combination of kind of all of these things. And then, I think part of it also last year, Arnav, is that last year was a really difficult year in terms of COVID, but we also had an election year. We also had a lot of racial issues going on. We also had wildfires. So I think for young adults like yourself, there was a lot to navigate.
Yeah, definitely, for sure. Even I noticed that not only through personal experience, but like with my friends around me, not many people were willing to go outside and hang out. Everyone was sheltered at home, and there's still a lot of like stress from school, like SATs, for example, and like AP exams. Everything just still came like running into our lives from school and extracurricular. So I totally understand why it might be stressful for a high school student like me, for example.
Absolutely. And yeah, I mean, I have two teenage, kids myself, and, they both told me that online learning is definitely suboptimal. So,
Yeah.
that's a good point. And in addition to all those other pressures that I talked about, of course, there's always academic pressure and, just trying to kind of stay focused and, learn something online is tough. I know all the science classes, for example, like not being able to do labs in person. For the humanities classes, the discussions were probably not as robust, when people are just doing chat on Zoom or in Google Classrooms versus in person.
Yeah, definitely. With that being said, what are some techniques maybe that you have in mind to keep the mental health of students in check? As relatively stressed high school students are feeling anxious to return back to normal as COVID cases plummet.
That's an excellent question too. So even though I think this is a tough time that we're all going through, I do think that your generation is going to be one of the toughest, most resilient generations that we've seen in a while. But there's definitely things that you can do just to kind of help yourself navigate through, these kinds of stresses or just kind of stress in life in general. Because honestly, we're not going to be able to completely eradicate stress. But I think what is good to do is to think about toolkits, things that you can use to kind of help get you through rough times. I think it's good to have lots of different tools. So the comparison that I make is just like a carpenter sometimes uses a hammer, sometimes uses a saw, sometimes uses a screwdriver. I think it's good for young adults as yourself to say, okay, I can try this, or I can try that, or I can try this, or maybe use a combination of those things. So specifically in terms of some of the things that I think are important, one, as I mentioned, is exercise. We know from a lot of research that exercise causes your body to release endorphins, those feel good hormones. So in addition to all the other benefits in terms of cardiovascular health, strength, stamina, definitely I think it's a mood elevator. I understand, as I said before, that people are not able to exercise the way that they might have been accustomed to. But I've been encouraging my patients to even take a walk around the block or go for a jog or ride their bike. Anything to get the body moving, I think is good. So exercise would be one of the things to consider. Definitely, I think sleep is an important consideration too. I think we have a lot of research that shows the importance of sleep in terms of good mental health. And it's not just the total time sleeping, but the quality of sleep that I think is important. The quality of sleep is based on time to go to sleep, because if you sleep too late, you just don't get as much good quality deep sleep. So I do encourage my teenage patients just to make sure that they get enough sleep and that they're not sleeping too late. Another thing that I think is really good to start to do is some mindfulness techniques. So I'm personally a big proponent of learning meditation. Meditation has been shown, again, in a lot of research to really help in terms of things like anxiety and depression and things like that. So luckily, there's a lot of really good apps that are available where you can do meditation on your own terms, on your own time. You have the convenience of the phone and it's right there. You can do 5 minutes at a time even. So Headspace and Calm are two apps that are available that I think can be really useful. Other forms of mindfulness include things like yoga. Not too early to start to get into a yoga practice. It's really good for flexibility. And, I know a lot of us have bad posture these days because we're sitting and hunched over. So yoga is really good for that. But I think also good for mental health. And then I think, of course, just having trusted resources. So, of course, parents or siblings or high school counselors, ministers, trusted adults, someone that, you can talk to about things. And then I do always emphasize to my teenage patients that it's important to know that there is help and it's not anything that, teenagers should feel ashamed or bad about. There should be no stigma around this, in terms of getting help from a mental health provider. So like a therapist, for example, can be really useful if you find that you're feeling anxious or down and it's not just, kind of every now and then, but, day after day, for like a few weeks or more.
Yeah, for sure. I feel like mental health has a very um impactful effect on just like everything to do with the individual, like physical health, like you said before, and things like working out like can really help with that because just by like going out and working out, it just increases self-confidence and it just makes you feel good and like as a whole. So I think those are very helpful techniques that you just mentioned. This brings me to my next question about exercise and working out. So lately, and even prior to the pandemic, students have had a high workload, and many don't really get to work out, like even after the pandemic, due to this high workload. So with that being said, how can students still manage to stay healthy despite not having much time to work out, and how significantly might diet factor into that equation as well?
Yeah, so I totally get that. High school students are busy. Like you said, you have academics, you have like standardized tests that you're preparing for. So it's really hard to sometimes think, man, how am I going to carve out, time for exercise? And, this doctor is telling me I need to get to sleep on time. How do I do all that? So, what I would say is that, again, research has been done on this, and research has shown that if you do some exercise, it actually helps you become more focused. So you actually get through your work in a more efficient way if you take some time out to exercise. So even though it sounds like, you're carving out extra time, it may not mean that you end up getting to sleep later because it might actually make you more efficient to get your work done. So that's one thing. The other thing I would say is it doesn't have to be, a long amount of exercise. Even starting off with like 10 or 15 minutes. And like I said, just taking a walk around the block to get some fresh air, get your blood circulating, clear your mind. I think it's good to take these baby steps and just kind of build upon them. In terms of nutrition, that's definitely something to consider as well. I think a lot of us have kind of slipped in terms of our nutrition during the pandemic because, especially when we were at home all day, it was so easy to just run down to the pantry and get some snacks. And, we don't only eat when we're hungry, we eat when we're bored. We've all been kind of bored a lot more recently, or when we're worried or stressed. There have been things that have made us all kind of feel more worried recently. So I think it's good to just, kind of be aware of those things and, kind of be intentional about the eating as well.
Yeah, for sure. All great pieces of advice. My next question is with regards to the immune system. So we've noticed that with the pandemic, there have been vaccine offerings to get immunized to COVID-19. So with all that, and additionally with the ability to take many different vitamins as usual, and just consume healthy foods, what are some very effective ways to keep the immune system in optimal condition?
Yeah. So we all want to optimize our immunity, especially these days with viruses going around, scary viruses. So yeah, there's definitely certain vitamins and minerals that have been shown to help boost your body's immune response. So vitamin C, vitamin D, and zinc, for example, are all things that we know do help your body's immune response to be most effective. So, as you mentioned, eating a good healthy diet with a variety of fruits and vegetables, getting good vitamin D from things like milk, cheese, yogurt, green leafy vegetables like spinach, kale, and broccoli. I think those are all good things just to kind of think about. We're not always perfect in terms of how we eat. So, in some cases, taking a supplement just to make sure that you're covering your bases is, a reasonable thing as well.
Yeah, for sure. So as our time comes to a close, is there any last piece of advice that you've had with regard to advising students with mental health and physical health techniques, especially as the pandemic comes to a close?
Yeah, so I think one of the things that I would just kind of emphasize is that it's more about the path than the end result. As long as you are just thinking about what you're putting into your body in terms of how you're eating, that's the most important thing. It doesn't have to be perfect, because sometimes if we set too many goals for ourselves, or really high goals, and if we don't achieve those goals, we just get frustrated and we stop. So I think it's better just to do these baby steps. Just come up with one little thing at a time that you want to kind of improve in terms of how you're eating. Don't worry about the others. Start off with just, like I said, a 10-minute walk. And this is just a foundation that you're building upon. Start off with just a few minutes of meditation a day and build upon that. So, I think sometimes it's better just to kind of take these small beginnings, and then the end result will come when it comes.
Yeah, for sure. I find that very useful as well, just taking small steps. Mentally and physically, it's helped me to really find myself, and I feel like just in general for students, it helps to just slow down a bit, um, and that can really help in the student succeeding mentally and just in academics and in life in general.
Hmm. Yeah, I agree.
Thank you so much, Dr. Singh, for taking the time out of your day to talk with us about mental health and physical health techniques, especially with regard to the pandemic and with regard to how teenagers can really find light in these tough times. We really appreciate it.
Oh, it's my pleasure. And, I love working with kids and young adults like yourself. And I really appreciate that you're doing this podcast to disseminate and share information.
Thanks for listening. Make sure to like our Facebook page, follow us on Instagram at Inspirante_education, and follow our LinkedIn for updates on future episodes. If you're listening on Spotify, follow our Spotify as well. And if you're on YouTube, make sure to like and subscribe and hit the notification bell to get notified about new episodes. Stay tuned for our next episode.